And that has to do with blood donations. Now, Kenya has been experiencing a dire shortage of blood, a situation made worse by the coronavirus pandemic. This has resulted in a drop of about 70% of blood donated. People in need of blood suffer, with some patients at risk of even losing their lives. The most affected are mothers and children, and who receive 2 out of 3 of every unit of blood that has been donated. So how can Kenya change this situation? Our reporter Sada Hassan explains.
In every 10 minutes, about 7 Kenyans need blood. On average, 1,008 people are asking for blood every day, according to the Kenya National Blood Transfusion Service, KNBTS. A spot check on social media platforms, either on WhatsApp status, Twitter or Facebook, reveals several blood donation appeals from friends or people you have never interacted with. Latest data shows that Kenya's blood banks are holding less than 18% of the demanded blood donated. In 2019, the Kenya National Blood Transfusion Service collected 164,000 units of blood, which is not even a quarter of the expected 1 million units annually. This has been attributed to the poor blood donation culture in Kenya, apathy, negative myths and beliefs, and low community awareness on matters of blood. Kenya's blood transfusion service was 80% dependent on donor funding, which, upon their exit on 30th September 2019, critical operations were affected, bringing the 31 blood centers spread across the counties almost to a grinding halt. In a move to bridge the gap and save lives, the Standard Group, in partnership with Damu Sasa, will spearhead the Show Your Love Blood Drive that will take place from 12th to 14th February 2021 from 8 a.m. to 4 p.m. at the KICC grounds in Nairobi and other donation centers countrywide. Sada Hassan, KTN News.
Very well put. The problems with blood donations did actually begin with that halting of donations, donor funds rather, that were actually very instrumental in keeping the wheels turning when it came to blood donation. In 2019, we are told that we only got 17% of the expected 1 million units, doing pretty badly. Then Corona comes in and makes things worse. So joining me to make heads of tails of this situation and of course inform you how you can be a part of the solution is Miss Asha Dafala, who is a leading female donor in Kenya. She has been giving blood since 1981. We also have Mr. Kennedy Sanya, who shall be joining us later on via Zoom. He is a leading male donor as well in Kenya, as well as Mr. Peter Mwangi here in studio with us. He's the founder of a leading blood group O negative community. They've formed a community that can actually, it's that serious. They need a community because this is a special group, and we shall have Mr. Mwangi actually explain why blood or negative people are actually special when it comes to blood donations. But onto it, let's start off with Ms. Dafala. Welcome to the show, Ms. Dafala.
Thank you.
Since 1981, that's pretty impressive. Why?
Yes, I started donating when I was 17 years.
Yeah, if you speak up, please, so that your fans can hear you.
Yes, I started donating when I was 17 years.
Yes.
I was in Form 3. I was in high school, and it was in 1981.
Yes.
Yes.
Why then? Because you have consistently done so, and you're in a country where it is often said that we lack a culture of blood donation. So what is the driving force behind you being very consistent with this very noble practice?
Now, as I told you earlier, when I donated my first donation,
yes,
I lost conscious, and I found myself in St. John's headquarters with my parents around. And after that, I stopped because I was really scolded by my parents because of the fainting. Though I was taken to the hospital, but the checkup was done and I was okay. It's just the bleeding. You know, okay. I had bled around 3 p.m. So I stopped. And in 1986, That time I was working for the Kenya National Assurance Company.
Okay.
I have a friend of mine, we were working together. She is Madam Leah Telila. She's working with the Kenya Wildlife Services now. She had a brother who had gotten an accident.
Right.
So she came to my office and asked me to go and donate for her brother. It was in Mata Hospital, and she took me to he was in the ICU. Then I went and did the test, and I did the blood donation. So ever since, I remember that my first, the second incident of me donating, I normally go donate because I know there's somebody somewhere who needs blood.
Yeah, so this was sort of like a seed that was planted. Yeah, but then you're here, of course, advocating for blood donations. What do you think, I'll get to you actually on what you think the problem is with that culture. People are not very excited about giving blood, and since the donor funds dried up, this is a time where we actually do need to embrace that even more. Now, on to you, Peter Mwangi. You are founder of a community of blood group O negative. Why do you even need a community? Explain to us why it's special when you have this blood group as a giver and also as someone who would be in need of a donation.
Okay, thank you. When I decided to create this group...
If you could speak up, please.
Okay. Yeah. The O negative blood,
yes,
is rare to get. And O negative blood, you can only be given by a O negative blood.
Okay.
Yeah. And okay, you can give everyone, you can donate to everyone, to any other type, but you can only receive from the same O negative.
So you, as a person who has O negative, can give to anyone in this room?
Yes.
Okay, and what about receiving?
You can only receive from the O negative blood group. Yeah. Now, when it comes to donating a blood, you realize the essential of the blood donating services when a relative or you yourself, you are in need of the blood.
And you cannot find some?
And you can, when you go to the hospital, they will send you to the relatives.
Okay.
And you see your family, maybe your nuclear family, you will get maybe 5 to 10. It's not a must that they will qualify to donate to you.
So what you're saying is basically...
This pushed me to form that community, so that when you are sent to search for the donors, you will have a wider, a big family now.
Yes. Okay, and speak to how rare it is to find someone who has O negative in the country.
It's very rare to know. You see, you can't go on your way and say this is O negative. Okay, this as negatives, all this as negatives are rare to find. There are not so many.
Okay, and therefore when you form this community, it makes it easier for you to actually reach out and donate. And let's get into the need, the people who actually need the blood, because perhaps, Ms. Aisha, you've talked about a person who had an accident and then you came in and were able to help. But it's not just people with who get caught up in accidents. There's such a wide range of conditions and people who find themselves in need for blood. Could you explain to our viewers who exactly would be under that bracket of someone who needs a donation?
Yeah, we have children, we have mothers, expectant mothers, and now we have like the cancer patients.
Okay.
They need blood. So you see the blood consumption, it's very high. And the way we say it's rare because people are not donating. And as you see, the way I've been donating since 1981,
right,
is that it's just back in my mind. Nobody pushes me. Though I've been getting a lot of support from the Kenya National Blood Transfusion. I've been like a family to them. They are so much concerned on me. Even they guide me on diet, what I can eat, what I should do. And they really impress me.
Okay.
So I have nobody who have been on pushing me to donate.
It's all out of your own volition.
It's out of my own condition.
Yeah, but then not everyone is like that. In Kenya particularly, people believe that something will happen to them health-wise, something negative will happen to them, perhaps they'll be weak. Have you ever felt weak, or have you ever felt any negative effects to being a consistent blood donor since 1981? That's
no,
over,
because you see, when you become a donor, there's a card you are given by the Kenya National Blood Transfusion.
Yes.
So you've donated, then there's the next day to donate. And when you donate, they have to check your blood level in your body. They just don't go donate. You don't just donate. There are some questionnaires you are asked if you've been you are having any condition, or you've been on medication, whatever. So I thank God that I've been okay. But you see, as a lady, when you are expecting,
right,
when you are breastfeeding, or when you are in your menses, you cannot donate. So me, when I'm on that condition, I was not able to donate. But when I'm fit, I just go donate.
Okay.
Yes.
And Mr. Mwangi, what can people do, or what have you experienced from people that you would say are red flags or problems in terms of our attitudes towards giving blood?
Okay. When people are being pushed to donate blood, some fears, so many, they fear they might go there and maybe get tested with some other illness. And that fear should not be there. Because when you are being tested, when you donate the blood, your blood will be screened.
Yes.
And if there is any illness, you will be helped by the doctors.
Right.
So it's also a benefit. So every community, everyone out there should not fear. Yeah.
Yeah, and Ms. Aisha, he's talked about a very important thing, the benefits of donating blood. One of them, of course, if you have the condition that you're not aware about, perhaps something with your blood sugar or your pressure, then when you go and donate, it's an extra test and you would be able to plan out your healthy life moving forward. Tell us about some other benefits to giving blood that are quite good, not just for the receiver, because we always focus about the person getting the blood, but also the person who's giving it.
Now, I'm 57 now. I turned 57 last December 31st.
Right.
And I thank God I don't have any condition. And people sometimes they are surprised when I tell them about my age. They say, you don't look 57. So I'm humbled when people say that, okay, you're okay, you are fit, you know. So I believe that the way I've been donating, even, you know, by the grace of God, He's the one who's given me this good health.
Yes.
Yes. And also, you see, I say when you normally donate, you are disciplined. You have a routine that you know. I have to live like this.
Okay. Be healthy.
Because I need to donate blood and to assist somebody. Yes.
So it even gives you, it's a sort of a push to stay healthy and maintain a certain lifestyle. Mr. Mwangi, what are other benefits to giving blood? And of course, in your view, you're coming from a place where there's a rarity in supply of a certain kind of blood, and at the same time, any other benefits that you see for people who are looking for an incentive to give blood, even though we shouldn't really need incentive?
Okay. Oh, okay. My thinking, when you are donating the blood,
yes,
that blood that is being sucked from your body, your body will replace it
Yes.
with another clean one. You see, so it's like you keep on puring your body, detoxification of your blood.
It's a form of detox.
Yeah.
Okay.
Yeah.
And as you move forward, as you work towards blood donation and increasing the amount of the numbers of people donating blood, tell us about how forming a pool of people with O negative has helped, or rather aided, in ensuring that people have saved lives. Perhaps you could give us examples of situations that were that benefited from you guys having that group.
Okay, we don't have a list there, but what we do when there is a patient who is in need of the O negative, although we don't only donate to O negatives, we donate to everyone.
Yes.
Yeah. What they do, they keep on, when you are being helped, they post it back. They say thanks, we got this. Yeah, but we don't keep the list. Yeah.
Okay, and we're joined via Zoom, or rather by Kennedy Sanya. If you can hear me, Mr. Sanya, welcome to the conversation. Mr. Sanya, can you hear me? We'll be sorting out his audio. I cannot hear a thing that he is saying, but then once we sort that out, we'll be roping him into the conversation. So, Mr. Mwangi, Ms. Aisha, could you tell us, of course, as we move forward, what things do we need to do to ensure, aside from what we're doing here, to ensure that the culture is built up and we ensure that people are donating blood? Because before that, I think before 2019, we had those donor funds drying up, and therefore the number went down. And then we had the coronavirus, and even people were now even more afraid of going to health facilities to give blood. So as we try to recover from that situation, well, how do you see us working towards ensuring more and more people come up and step up to be part of the solution?
Yes, it's, so far I've donated 66 times.
Wow.
And I'll be donating my 67th time. And since I have, I said I want to donate, I want to do 70.
Okay.
So when I reach 60, I want to do 70.
Right.
So before I reach the 70, I want to have something like a dream I have. I want to see that Kenyans are donating blood. And so far I've started my Facebook page. And I've started mobilizing Kenyans. And as my brother, whatever he's doing, when somebody acquires blood, when I have that appeal, I put in my Facebook page.
Right.
And I have some people who really is on that. And I'm seeing that people are being assisted on through that. And as he's saying, we don't, when you assist somebody, you don't do the follow-up. But right now, I need to do the follow-up because I want to see, by end of December, I want to have mobilized at least 100,000 Kenyans to donate blood, and I need regular. When I say regular, it's you come like for male, they donate after every 3 months, and for female, after every 4 months. So I want to see when somebody comes and donate, to come after another 3 months, So by December, at least we'll have like 300,000 units of blood. That will be a plus. Yes.
So using the power of social media to create a community that would actually be pro-blood.
Yes, that's what I've started so far.
Yeah.
And I'm planning to do more. Since I've met Peter Mwangi, we are planning to have something which we can do. You know, teamwork is it's a
makes the dream work.
Yes.
Okay, Mr. Mwangi, speak to that, the power of social media. Has this come in handy in your efforts?
Okay, since I started it back in 2017, okay, to start with, it was not easy to reach to those people countrywide.
Yes.
Because I started it with like 5 participants. Then They enjoyed it until it was 257, the maximum number.
Right. Mm-hmm. And so
now it's easy to reach many people through social media, because like the one we are using, WhatsApp group, you just post it and everyone, whether he is traveling, whether he is in the office, he will get the message.
mm-hmm.
Yeah. Mm-hmm. Now the thing is, now we are trying to combine effort with the other groups like the Aisha Foundation
Mm-hmm.
and the others like Damusasa.
Okay, and speaking of Damusasa, Aisha, are you aware of this app, and could you explain to us how it works and perhaps why it's important for us to adopt these means of spreading the word and bringing people into the culture of blood donation?
Yes, Damusasa, it's an organization which is, in fact, we are working together, and we are mobilizing people to donate. And right now, Damusasa has an app mm-hmm. where you can download. You can do blood appeal.
Right.
You can go donate. Mm-hmm. You go book and you book, and you are told the nearest center to go and donate.
Okay.
And also there are some answers you can get through that WhatsApp, because people are lacking. There are some awareness people they don't have. Mm. So through that Damusasa, there is a lot of information you can get through Damusasa. Mm-hmm. And also we are working together with the Ministry of IT to see that if you donate, like if I give out my blood, because ever since I've been donating, I don't know where my blood goes. Mm. But I'll be able to know who is the recipient of my blood. Okay. Through the technology. Mm-hmm. They are working on it. Mm, and how? And I'm glad that the minister, the cabinet secretary, Mr. Untitled, he's working so hard. He's doing some reforms. Mm. So far, he has done a lot. Mm-hmm. And they've called me to work and see how we can work together. And I'm really impressed, because at least I see there is a future of my dream.
Yeah, earlier on, I do believe this was in 2020, this year, and I'll just read here a quote from him. He said, "A critical review of the blood situation in Kenya shows that there is a huge gap that we have," and he was acknowledging that there was a problem. So, Ms. Aisha, as you work with the ministry, what sort of reforms have you witnessed as someone who has been part and parcel of these efforts for years?
As you see, I've been a donor, blood donor. Though we've been working together, there are some things which it's out of my hands. Mm. But me, my important thing, I see that I donate blood. Right. And I mobilize other people to donate, because everybody has its part, has our own role. So my role is to mobilize Kenyans to donate blood, and that's where they really need me.
Yeah, and that role you play out. But when you open the papers, let's take an example of 2020 and late 2019 and see stories about blood units getting spoiled because of poor storage or people stealing blood. What comes to mind? What does that evoke in you? And what would you love to see happen in terms of management of these resources?
Dr. Korir, sometimes I'm surprised, because you steal something which is there. We are told our blood bank is empty. Okay. What is being stolen? There's nothing, because the blood bank is empty. Right. And as my brother said, now what is happening, it's relative donor. Okay. Relative donor is where you have a patient, you look for your relatives to come and donate. Right. And you see the patient is in the ward waiting for the blood. So there's no time. The blood is waiting for it to be screened and to be given to the patient. Yeah. So there's nothing stolen. Yes, because there's nothing. There's nothing in the bank.
There's nothing to steal.
There's nothing to steal.
Mr. Sanya is joining us via Zoom. I hope you can hear me right now. Mr. Sanya, we are talking about the situation with regards to availability of blood in the country, or lack thereof. Now, we've established that owing to coronavirus and a lack of donor funding, we are struggling in terms of getting those units. What's your take on that? And perhaps what can the Ministry of Health and other players do to improve the supply of blood to those who badly need it?
Morning, Daktari. I hope you can hear me. Thank you so much. I'm sorry I've been late.
It's okay, it's okay, it's okay.
What I'd like to urge Kenyans and each and every one of us is we have to, be our neighbor's keeper, as the good book says.
Okay.
And the only way we can do that is by donating blood to save a life.
Right.
We have to come and join hands, as we've always been doing since independence. So let us always have time. I always challenge people nowadays, on your birthday, donate blood. If you cannot be, like us who've donated over 60 times, donate blood on your birthday. And I think this will bring a big difference in our country, because we really have a shortage of blood in the country. And we have to come out as Kenyans tusaidiane sisi wote.
And perhaps some of the reluctance that we see from people who would otherwise be donors is the fact that perhaps they don't have faith in the fact that this blood that they're giving will be put to the right use, it won't go bad, and things like that we often read in the press. What would you hope to see in terms of management change so that we are having a well-oiled machine from the donor to the person who needs it?
As a developing country, at least Kenya, since if we look back since the bomb blast, we've made strides, and it's through technology, and as a country, we are getting there.
Right.
It takes time, yes. There may be difficulties here and there, but as a country, Kenya, we are taking the right direction. We have a new CS, Mr. Kagu.
Yes.
He's doing so much, and with the advances with technology, the refrigeration of blood and all that. And once all blood centers are opened in all the 47 counties, there'll be a difference. There'll be a good difference, because now at least, because we have satellite centers. But once we have those fully running blood banks in the 47 counties, I believe as a country we'll have enough blood for each and every one of us.
Okay. Mr. Mwangi, would you chip in when it comes to the fact that the coronavirus has made the reserves quite depleted? Speak to me about the fear from the people that I don't want to go to hospital because, of course, I don't want to be infected by something. I don't want to go to these facilities for fear of exposure. Could you speak to that, and what advice would you give to people so that they might regain their confidence in terms of giving blood?
Okay. It was hard during the coronavirus.
Which is still happening.
Okay, what we are experiencing right now, the situation on the side of the blood surfaces is, I think it's worse than corona. So if we are below 20%, we need to wake up. We don't have to fear. Right now, we have to stay with corona.
Yes.
We go, as we follow the measures, we just go and give the blood.
But from your experience, could you speak to the safety that and the measures that are being put in mind and implemented at the centers so that people can actually know that they will be safe?
Okay, the Ministry of Health has done everything to make sure you are safe. So when you are when you are donating the blood, every measures are being taken care of. Not only the COVID-19 measures, but everything concerning health is being taken care of. Yeah.
Okay. And Ms. Aisha, what would you advise people in terms of this crippling fear that makes them stay away from the centers?
I'm glad that Dr. Nduku, she's the current National Blood Transfusion Director.
Yes.
We've been having some meetings because I wanted to have a blood drive. And she told me there are some guidelines they are making because of the COVID. And now they are done. That's why we are doing the first, in fact, it's the first blood drive during COVID. on 12 to 14.
Yes.
But last year, when almost the COVID started, we did a blood drive. There was an interfaith blood drive I organized in the 7th and 8th of March. And we got like 152 pints of blood. So to people, regardless of the COVID, we have patients who need blood.
Yes.
And it's important we continue to donate blood and see that no Kenyan is dying because of lack of blood.
Yeah.
Yes.
It's very important. That's a very important thing that you've raised. The fact that we are having a pandemic doesn't mean that mothers and children and people suffering from diseases such as cancer are not actually getting are not done away with. These conditions are still there and they're still among us, and therefore donations must be maintained. Mr. Sanya, we are experiencing, part of the reason we are experiencing this shortage is because there was there is a lack of donor funds, or a reduction in the funds that were behind blood donations. So in your view, what can we do to build this? Should we be shopping for new partners in terms of donor funds so that this can be a thing that is supported? Or how should we move towards ensuring that there's more and more supply for the people who badly need it?
I think the best, what I've seen, what I believe, as a country, I think we're enough. But if we can get the students, if we can last the Ministry of Education, because that's the best reservoir as a country that we have. Because I remember when I started donating blood, I was in school, in secondary school here for one high school.
Yeah.
And if the national government can partner with the Ministry of Health and the Ministry of Education, I think we can get on very well. In fact, we'll get an oversupply of blood, I believe. Getting the students would be the best.
But I would imagine that is already the biggest donation demographic, if I can say that. Ms. Aisha, most of us first gave blood at school. So is there another part of the population that we should be looking at and trying to tap into that isn't giving? Perhaps people above 50. You yourself, you're above 50. You donate. Is this a group that needs to be targeted as well?
As I started donating when I was in school.
Yes.
So I'm sure you should start, you groom yourself. So when you start when you are young, because I believe nobody at 50 now, at 50 will start donating blood.
Yeah.
So I think we should concentrate on the youth also. When we groom them, and I'm glad to say that I have my son who is 25 years old. And he started donating when he was in Form 3 also. And so far he has donated 12 times.
Right.
So I can see the importance, and everybody should start, like me, I started with my son. You start with your brother or your sister, because we don't need only men to donate.
Yes.
Even ladies. In fact, we are the most strong who are there. You see your child dying because of no blood, so you should have that heart to see that, let me donate and see that nobody is dying because of no blood.
Right.
Yes.
Mr. Mwangi, what's your idea of how we can actually increase those numbers, or rather perhaps inculcate that culture from that point of high school? Is there another group we should be targeting, or should we just be, moving with the generations and maintaining it?
Okay. COVID-19 taught us a big lesson. There was no schools.
Yeah.
So if you target the student, you can get them. So it's time now to look for another way.
Diversify.
So that we can, anything can happen. We saw it. Anything can happen. So it's the time we form like the groups we are forming, then we join hands and we come up with the solution.
Absolutely. And Mr. Sanyas is joining us via Zoom. He's talked about, forming communities. He's part of the O-negative community that is actually has come together, and of course they look to each other for blood donations for everyone, or perhaps for each other. Then we have Ms. Aisha, who has been donating since 1981. Tell us your story. You are seen, you also, I'd say, a veteran blood donor. Tell us your story? What is behind this motivation, and how would you encourage people to be a part of it as well?
Okay, like I think all of us, most of us who have that foundation in blood, we started when we were in secondary school. And I remember it was my colleague who came with a Fanta, a soda.
Okay.
It was during these exam times, so we were not basically in class. So I was reading my novel, James had chase of a fan. And then he comes with a soda. Then I'm like, umetoa soda.
Yeah.
Si nimepatiwa, wewe ndio utoe damu alafu upatiwe soda. I was like, you too. I put my James had checked out, went to the biology lab where they were doing the blood donations.
Right.
And that's how I started. And I think that motivation, you know, since then, when I realized there's no big deal, you donate blood and you're well. And it has health benefits. And since then, I've never looked back.
Yeah, and there's of course I've talked to our guests here before you came in about the fears that surround donating blood. Some people do not want to know or be diagnosed with a certain problem because they have to make sure you're healthy before you give blood. And at the same time, some people don't believe that you can maintain a normal, healthy life if you give blood as often as people such as yourself. So what would you say to those fears that people have in terms of perhaps they'll discover I have this and that disease, or at the same time, perhaps I might just be weak, I might faint, something might happen to me when yeah, so please address those fears.
I think, number one, the fears are unfounded. It's not true. If anything, whatever condition, if there is any underlying condition that you may have, it will be more beneficial to you because you'll know it early and you'll get the necessary treatment that is needed. Otherwise, in fact, I always tell people, once you donate blood, it's kind of a medical health check. In fact, it's the government which is paying for you at no fee. And if you go to a private hospital, you'll pay a lot of money.
Right.
So it's good to know. And they'll always advise you whichever way, whether it's good or bad, but they'll give you the way forward of how to handle any situation that you may be having. So it's always good. Like what I always donate 3 times in a year.
Okay.
And through that, if in case there's any medical condition that I may have, I'll always be advised by the personnel at the blood donor center of what to do and the way forward. So it's a benefit to you. It's a you should not fear.
Yeah.
I also feel it mpaka saa hii.
Yes.
But overall, it's something very nice. There's nothing bad.
Okay.
Those fears are unfounded.
Yeah, and Ms. Aisha has also talked about how she uses social media, and of course there's the Damu Sasa app. What is your take on the use of online platforms to marshal support and of course get people going in terms of donations?
It's very important, and you'll also capture a big number of people. I've also joined the Damu Sasa, and also we also have WhatsApp groups. When somebody needs blood, we share. So it's also a benefit. It really helps. Even on Facebook, when there's a crisis, we always put the information forward, and imagine you'll always get a response in the country. We've never been let down whatsoever. Hakuna siku tumepata aibu yoyote.
Okay, Mr. Mwangi, talk to us about your view of, social media platforms as a way of getting, people to donate. And at the same time, perhaps the people who are watching have no idea where to get this app, Damu Sasa. Could you explain to us how people can actually find their way to this app and, of course, learn and and benefit from it?
Okay. Through social media, it's easy to access information. Okay, we have that Damu Sasa application. You can get it from the Google Play. Then you download, you register.
Okay, short and sweet. Ms. Aisha, I do believe you had a point you wanted to make.
Yes, I wanted to tell Kenyans that they should have this culture, a routine to donate, because You see, when we have a tragedy, like when we had the Westgate, the Dusit, the bomb blast,
right.
when you go donate, people go in huge numbers to donate. But remember, somebody is critical somewhere, waiting for the blood. So normally, somebody would lose life because the blood did not reach in the safe time. So what I'd add my fellow Kenyans, we have that.
Before you get into that, please explain to us the lag time between a person donating and it getting to that person. Why wouldn't, because some people might assume it will go from me and directly to the person who needs it.
No, you see, when you donate, the blood has to go for screening to be seen that it is safe to be given to the patient. It's not just go, it's been bled and taken there. So there is a procedure.
And how long would this take?
You see, my brother Sanya said that there are some tests which are being done because it's been HIV, hepatitis, STIs, whatever. And you know, it's a process.
Yes.
So you can imagine that process, even if maybe it's like 4 or 5 hours, the patient needs blood there and then.
Yes.
So what will happen? The patient would die. So we need to have blood waiting for, we don't expect people to be sick, but at least blood should be there. In 2019, I got an opportunity. I was invited in Rwanda for the World Blood Donor Day. And I had an opportunity to be taken to the blood bank in Kigali, and bloods are there, waiting. So I'm hoping that Kenya will reach there very soon. And it needs me, you, and other to get that blood to be stored.
Okay.
Yes.
Yeah, we need to have sufficient reservoirs for blood. Now, Mr. Sanya, speak to us about the access to these facilities. Perhaps someone is watching at home, they don't know how to start. Is it a hospital? Are there special centers? The Red Cross facilities? How can someone get out if they're not a student that would be waiting for the Red Cross people to come to them? How can they access facilities where they can give blood?
True, the most referral hospitals at the county level always have an office where, a department where one can go and get blood.
Yes.
And also the Kenya Red Cross. So just avail yourself at any Kenya Red Cross office or any hospital. You'll always be directed, because since we have a shortage of blood in Kenya, there's no way anyone will ever be turned away. Ukijitoa tu unataka kutoa damu. Never ever. So just walk to any hospital, any public hospital, you'll always get assistance and the direction of what to do and how to donate the blood. We've never ever taken somebody back, never ever. We need that blood as Kenyans.
Okay, and Ms. Aisha, I do believe you wanted to add to that point?
Yes, as I said earlier, we have Damusasa,
yes,
the app, and also we have other, we need like, to do awareness on blood donation and the centers, and also like in Nairobi, I wouldn't want to see a vehicle from Machakos or Kajiado to come to Nairobi to collect blood, because blood comes from a human being.
Yes.
We have human beings in Kajiado, in Kiambu, in everywhere. So we need to have like blood drives in each county for it to have its own blood. But as in Nairobi, we normally have referrals, people coming from other counties to come for treatment. That we can work on it. But no ambulance or only vehicle should come to collect blood from Kiambu or from Kajiado or from wherever, the nearest. Yes.
Absolutely. And Mr. Mwangi, do you think more could be done to ensure that the blood banks are closer to certain cities or towns, or, you know, so that we're not seeing that zigzagging or crisscrossing between county lines? What do you think could be done to ensure that doesn't happen?
Okay, as Ms. Aisha said,
yes,
we need to have blood banks in our counties. So that when the blood is needed and the patient is on the county hospital, he or she don't have to wait until the blood is taken from Kenyatta Hospital to the county hospital. So what we can do is to have a blood bank in our nearest health cares.
Okay.
Yeah.
Okay. And Mr. Sanya, you're hearing the comments about people being referred to another hospital or an ambulance having to rush to another county to bring blood. What is your take on that, and how better can we work that out?
It's true. It's so sad when you find, like, in Nakuru, we have to wait blood from Nairobi to come to Nakuru. I think we should, as Kenyans, take care of our neighbors. And your immediate neighbor is the person who is in your county. And we can only do and avoid such scenarios when each county, I think the leadership in each county should now come out and take a step so that the residents of that, whichever county we have, are encouraged to donate blood at whatever schools, colleges, and those who are working, and those who are also not working, the business community. Let us all come out through churches, when there are gatherings. Let us have a blood drive, not only for other issues, but to save a life. When people are gathering, like during this Valentine season, in Nakuru, and I think in Nairobi and in Nyeri also, the blood bank, the hospitals there have come out to encourage the residents of those counties to come out and donate blood. So it's encouraging, and let us, at the church level, let us also have, like we have Easter. The churches can also have a special day in the country, for people to donate blood on that particular Sunday. The mosque on that particular Friday, something like that.
Okay. Now, I'd like you all to give your closing remarks on this matter. I'll start with you, Mr. Mwangi.
Sorry?
Your closing remarks.
Okay. What I can tell the community is to show love, particularly on this weekend. Go donate your blood. It's just a pint once, and you will show your love to your loved one and to the patient.
So that's a way of giving, particularly in this Valentine season, giving of yourself. Ms. Aisha.
Yes, I'm urging my fellow Kenyans. I'm donating my 67th time, and I urge you to come and be with me and come and donate, because we need to save lives. And to my fellow women, we are the most people we have our children, we have our husbands, we have our mothers, we have our fathers, so we are the ones who are in care. So we don't need to see people dying and crying. So you can donate and cry a little, but not cry. So please have that culture of donating.
Right.
Yes.
And Mr. Sanya, your closing remarks?
Let us show love, let us save lives. And Aisha has talked about the women. Let me talk about the men. Able to take control. Let us be the number one as we are doing. I wish you well, and God will bless Kenya. We are a great country, and it shall be well.
Okay.
Thank you, madam.
Okay, and as we close the conversation, I'm getting a question here where you can get a donor card. Perhaps you could explain it again, Ms. Aisha. A donor card, how does one get one?
You see, when you go to Kenya National Blood Transfusion, when you go donate, you are given a card. And that card shows that you've donated.
Yes.
And when are you supposed to donate the next donation?
Yes.
People sometimes they don't understand. You see, when you go and donate for a relative, you've not donated for, it's not for the Kenya National Blood Transfusion. Maybe you go to a certain hospital and you just donate. So when you go and donate with the Kenya National Blood Transfusion, there is where they have the bank.
Right.
And they'll recognize you. When you donate and you have a patient, when you need blood, National Blood Transfusion, they'll give you blood. But you see, when you go and donate for a relative, you donated for a person.
Yes.
Not for You know, it's not that we've gone voluntarily to donate.
You're not contributing to the National Reserve.
Yes.
Yes. Thank you very much. That is Ms. Aisha Dafala, a leading female donor in Kenya. She's been giving blood since 1981. That should serve as a challenge to you. And we were also joined via Zoom but by Mr. Kennedy Sanya, also another leading donor in the country, as well as Mr. Peter Mwangi, the founder of a leading blood group O negative community. You can reach out to them online and of course get the app that we have just talked about and get yourself to be a part of the giving community. You can give your blood and celebrate in a special way this coming Valentine's. We are going to take a short break. When we come back, we're going to have some stories awaiting you from both the local and international sphere.